Hello all, we are proceeding with our session of INI CET based question discussion on transfusion medicine subject, which would be mostly a clinical kind of discussion. Today's discussion would be based on the hot topic of the year 2020, that is COVID. And regarding transfusion medicine, the important update which has come up in the field is convalescent plasma for COVID. And as a doctor, everyone should know what are the selection criterias and the treatment criterias for using convalescent plasma. However, the effect of it is not a good improvement in people who are going from mild to moderate disease of COVID, and some marked improvement has been shown in the clinical profile of the patients. Coming on into the question, it says about we are taking rounds in COVID ward, and we encounter a 50-year-old diabetic male who's been tested for COVID RT-PCR positive one day back. He's having mild kind of COVID only, but intermittent fever for the past 2 days is there. You consider to give him convalescent plasma therapy, and you have to choose among the options which donors, which I mean that post COVID survivors would you choose for donating a ideal convalescent plasma. And in this kind of question, there may be multiple correct options, and we have to search for it. And option A says about a 17-year-old healthy college student who has recovered from COVID-19 one month back. And option B, 40-year-old female with one child of 10 years age. And C, an asymptomatic COVID survivor who had completed his quarantine 10 days back. A 50-year-old hypertensive patient who is on tablet telmisartan 40 mg OD with controlled BP. Option E is about a 20-year-old unmarried girl with hemoglobin 12 gram per deciliter. And option F is about a 59-year-old healthy post-COVID survivor who had completed his quarantine and isolation period successfully but has not done repeated testing for to know the criteria. Starting from the age, the minimum age should be 18, maximum 65 years, and the weight should be more than 50 kg. Hemoglobin should be more than 12.5 gram per deciliter. BP of systolic between 100 to 140 is acceptable, and diastolic 60 to 90 is acceptable. And food intake, one should have taken food 1 hour before donation, and one should avoid fatty or oily foods for 24 hours prior to the donation to prevent the plasma from getting lipemic, which would cause problem both in the patients receiving the plasma and also the collection system which is being used for collecting the convalescent plasma. And after 14 days of symptoms resolution in the COVID survivor, however, testing negative again is not mandatory. And for females, we should not accept during the menstruating days of the female, and the females which we are planning to accept for convalescent plasma should not have any history of pregnancy or abortion, because during those time of pregnancy or abortion they have chances of developing new HLA antibodies that can occur in the plasma of that individual. And regarding diabetes or hypertension, for those diabetic patients on oral hypoglycemics and having a very good diabetic control, you can safely include them. But however, those who are taking insulin, they come under permanent deferral criteria for any donation of blood components. So that will be included for the convalescent plasma also. And the same thing for hypertension. If the patient is on a regular checkup and he is having a very controlled BP, even with medications, he history of major surgery within 1 year, and history of minor surgery including those dental extractions and invasive cosmetic procedures like nose pricking, ears piercing in the last 6 months cannot donate. They have to be deferred. And kind of histories like tattooing also, they have to be deferred for 1 year period. And those are regular medications for cardiac, epileptic and thyroid disorders should also be denied from donation. And those with high risk behaviors having chances of transmitting transfusion transmitting infections like triple H, syphilis, malaria, etc. should also be avoided. And those who are having regular habits of smoking and alcohol consumption should be avoided. And for all the convalescent plasma which is being collected, mandatory serological screening for 5 diseases. As for in India, now these 5 screening is mandatory. They are HIV, hepatitis B, hepatitis C, syphilis and malaria. And the plasma which we are collecting is then tested for the blood group, because the plasma, however we are collecting only the plasma, aiming to collect very less amount of RBC traces, they are usually transfused group to group. And so this after collection they have to be stored below 30 degrees Celsius, and the expiry of this product is 1 year from the date of collection. And it is required to have IgG in a required concentration depending upon the kit and the system which are being used for collection, and should be issued to the same group individuals. And the dose is usually 2 doses, 200 ml each, 24 hours. And it should be used for those individuals at early stage of COVID-19 or moderate stage patients with contraindications for remdesivir or favipiravir. This is the ICMR guidelines which has been recently published. It shows that the potential donors are men or women who have never been pregnant, ages 18 to 65, appropriate weight is more than 50 kg. They should be RT-PCR positive 14 days after symptoms resolution. They have to be screened for triple H, not only triple H, for syphilis and malaria also. And the required concentration of IgG titer should be 1:640 in ELISA or 13 AU in cases of CLIA, and neutralizing antibody titers of 1:80. And the potential recipients are usually in the early stage of COVID-19, that is 3 to 7 days from the onset of symptoms but not later than 10 days. And there should be no IgG antibody against the COVID-19 by the appropriate test with informed consent for high risk. And coming upon to our question, it says that we'll look after one after other. First, it says about a 17-year-old healthy college student who have recovered from COVID 1 month back. Now, that 1 month back is okay. That comes into our criteria. But the age is 17. However, the minimum age is 18. So, he cannot be chosen. And B is about a 40-year-old female with one child of 10 years. She is already pregnant once, so she cannot be accepted. Then an asymptomatic COVID survivor who had completed his quarantine so he would have already been 14 days in quarantine, and now it's 10 days, so it's 24 days after his illness, so you can take him safely. So C comes into our correct option. And then a 50-year-old hypertensive patient who is on telmisartan 40 mg OD with controlled BP. He is in controlled BP. So however he is on oral and antihypertensive, we can select him, and the age is also 50 years till 65 years you can accept. So he comes into our criteria. So option D is correct. Now option E is about a 20-year-old unmarried girl. Okay, 20-year-old, age is correct. Unmarried, okay, you can take. Hopingly she is not pregnant or not had any history of abortion previously. And the hemoglobin is 12, but the hemoglobin criteria is 12.5, so she cannot be selected. The option D is about a 59-year-old healthy post-COVID survivor who had completed his quarantine and isolation period successfully but not been tested second time to confirm his negative status. It's already like he has crossed his quarantine and isolation period, so he has crossed that 14 days timing, and there is nothing mentioned about the symptoms also. Age is also 59. Okay, and this negative status report is not mandatory as we saw in the guidelines, so he can also be included in our criteria. So among all these options given, the options C, D and F are correct options. So thus this discussion of us also ends, and I hope you have enjoyed this kind of learning.